recorded, and it will be archived on our website tomorrow. So if you have friends and colleagues who are on the other webinar, you can exchange links and check it out. So, a little end plan. We're funded by the Robert Wood Johnson Foundation to provide legal, technical assistance to communities that want to use law and policy to create healthier environments. We develop model policies and work with advocates and public health officials around the country to use policy to create healthier environments. We've developed 2 model policies that can help improve access to fresh fruits and vegetables in your community. We have a produce cart policy, which we just released last week, and a farmers market policy, land use protections for farmers markets. So both of those are available on our website, and they will be the focus of our webinar today. So let me show you the plan for today. I will do a brief overview of the food policy landscape that farmers markets and mobile vending fits into. And then Amy Ackerman and Steph Stevens, 2 of our staff attorneys, will talk about farmers markets and mobile vending policy and law. And we're very fortunate to have one of our project advisors, Kami Potakuchi from Wayne State University in Detroit, talk about her experience in implementing EBT at a farmers market on the Wayne State campus. And then we'll have lots of time for question and answer. So, started with the meat of the presentations today. So before we get too specific into local policies, which is what Amy and Stephanie are going to talk about, I wanted to take a step back and talk a bit about this foodscape that these policies are a part of. This is not where this is in the dictionary. It's a loosely used term to describe the food policy landscape. And it's a pretty popular term that you'll see in blogs and popular media online. So first, I don't need to really convince you of the benefits of fresh produce as part of a healthy diet. Since you are on this webinar, you're probably already interested in that. Just to remind ourselves of why public health wants to promote the consumption of fresh fruits and vegetables. Their consumption are associated with a lower risk of cardiovascular disease, several different types of cancers, and diabetes. Also associated with the maintenance of healthy weight because it's energy density, but has a lot of nutrients that your body needs. But fortunately, people who are the most at risk for obesity are also the least likely to have healthy diets. So low-income people, people of color, are less likely to consume a lot of fresh fruits and vegetables or meet the dietary guidelines. And a couple of issues have been identified as hindering people's ability to eat more fresh fruits and vegetables. In particular, affordability and access. On the affordability side, research shows that low energy density diets that are rich in fresh fruits and vegetables are more expensive than high energy density diets. So if you took a cup of apples and a cup of candy, a cup of apples is lower energy density, it has fewer calories than the same quantity of candy. That's what the energy density item means. Further, in the current economic downturn, it's really important to note that the cost of fresh fruits and vegetables is more susceptible to inflation than the cost of other foods and other products that people buy. So their cost increases faster than, say, the cost of sweets, sugar, and other products. As people are being squeezed, it's more and more difficult for to purchase fresh fruits and vegetables and other components of a healthy diet. On the access side, there was a recent study by the USDA on food deserts, which are places that have limited access to food retailers, and in particular, they're looking at supermarkets. supermarkets. They recently released a study back in June of last year, and one of the big findings of the food desert study was that about 23 million Americans live in low-income areas that have limited access to supermarkets. And supermarkets are kind of important because they tend to have a greater variety of foods, and they often have lower prices than smaller grocery stores or corner stores. And the study defined limited access as, overall, they defined it as living less than 1 mile or more than 1 mile from a supermarket. But they did do some fine analysis of different populations, rural populations and urban populations, because the mile standard doesn't necessarily apply to a rural area, which by definition has a lower population density. Things are more spread out. So they did some analysis of access in terms of drivability. So high access was defined as being less than 10 miles from a grocery store in a rural area. And so if you're interested in those details, I would encourage you to check out the study on the USDA website. We have these two concerns: affordability of fresh fruits and vegetables and access to fresh fruits and vegetables. And we can use policy at all levels of government in order to reduce these barriers so that make it easier for people to purchase and consume fresh produce. So before into the local level, I just want to take a quick look at how federal food policy affects local food policy. And even if you work mostly at the local level, there are a lot of things that the federal programs and policies that might help your work and improve your ability to provide access to fresh produce. So most well-known initiative that was recently released was the First Lady's Childhood Obesity Prevention program called Let's Move. It does have a component of encouraging access to fresh foods in neighborhoods. Also recently released recently launched was the Healthy Urban Food Enterprise Development Center, which will provide support to local businesses in urban areas around the country that are helping to build the local food system. So food distributors, food processors that are supporting the local food system. Also at the USDA, there's a program to support farm-to-school programs, which get local produce, which connect local producers to food service directors in local school districts. And that program was initiated in the last Farm Bill. The final program that I just wanted to mention was the release of the new WIC food package, which now allows some of the food vouchers to be used for fresh produce, which is really exciting. Finally, we're getting down to the local level, and I'm going to run through a few different ways that fresh fruits and vegetables can become more accessible at the local neighborhood level. All ideas apply to both urban and rural settings, although they might look a little differently in different types of places. The first and most obvious is if a neighborhood or community has limited access to fresh fruits and vegetables, one solution is to get a grocery store or supermarket into that neighborhood, and that's what I'm calling the bricks and mortar option. So policy can be used to provide incentives and to make it easier for grocery stores and supermarkets to move into an underserved neighborhood. Local government can also work with existing retailers, say corner stores, to provide incentives and assistance for them to provide more fresh produce in their stores. I would encourage you to check out this Getting to Grocery, which is available at the Public Health Law and Policy website, which I'll put a link up in a little bit. It puts a lot of great ideas for how local policymakers, local public health officials can attract healthy food retail into underserved neighborhoods. The way to get produce into neighborhoods is to create space for the community to produce their own through community gardens and urban agriculture. And we also have a few resources on this to come up. We also had a webinar on land use protections for community gardens 7 months ago, which is archived on our website. So if you're interested in community gardens, definitely check out these resources. So you can get fresh produce into schools through the farm to cafeteria projects that I mentioned already, and school gardens, which can be incorporated into science, math, reading curricula, and also have the benefit of getting outside and learning about how food is produced. Even better, you can get the school garden produce into the cafeteria and even use that as an opportunity to teach kids how to cook fresh fruits and vegetables as part of nutrition education. Finally, we move to the two policy areas that we're going to talk about today, which we're calling pop-up venues. This is a term that we made up here. You're hearing it first today. And we're using that as a way to describe temporary markets that kind of pop up, are available for a few hours on particular days, and then they go away. So in particular, we're talking about farmers markets, which are a great way to connect local farmers to people who want to buy their produce, and produce carts. This is a green cart in New York City. This might look different in a rural community. You might have a cart outside of a large employer like a hospital or a larger business to provide fresh produce to the employees there. So Stephanie and Amy are now going to talk to you about how the law affects these types of markets and how policy can promote them. I know a lot of you, based on your registration information, are interested in implementation and funding, and those really specific details are outside of the scope of this webinar, but we are going to post some resources on our website this week that will hopefully connect you with the organizations that can help you with those specific issues. Without further ado, I will pass the microphone to Amy and Stephanie.
Good morning and good afternoon. I just want to make a couple of housekeeping announcements based on comments. First of all, we have over 400 attendees on today's webinar. I know my mom was going to try to attend, but I don't know if she worked it out with her computer. But hi, Mom, if you're there. I also want to let people know that we are recording this webinar, and it will be posted on our website, and that's www.nplan.org. Also, we'll be posting this resource list that Christine just talked about, and this will be on topics that we don't deal with, but we've collected some resources we think will be helpful for you, because there's some great organizations out there doing some fantastic work around particularly farmers markets, and there's some funding resources, information about public benefits, safety and risk prevention, market management, and so forth. And we will also make the slides available after the webinar. So I'm going to get started now when I can get my slide to change. Okay, so we'll talk about a farmer's market and mobile vending, mobile food vending. And to that, we've got to do a little bit of talk about law. I know it's a little horrifying, but I promise it won't be too bad. So when we talk about regulating these kinds of food sales, we need to look at state law, the retail food law, which protects consumers' health and safety. Also, we'll be talking about local law and the type of local regulations that can promote this type of food sales. they're often land use and zoning regulations or some other type of police power measure. And when we talk about police power, these are essentially the laws that state or local governments pass to protect and promote the health, safety, and general welfare of citizens. To start with the state law and understand the state law, we've got to talk a little bit about the U.S. Public Health Service Model Food Code. And a new one was just issued from 2009. And the Public Health Service got involved with food safety back actually at the turn of the 20th century in first with milk. And they wondered why people got sick from drinking milk, and they did studies and realized that there were ways in which you needed to handle and keep and preserve milk so that people didn't get sick. And the first milk they came out with had to do with milk, and it's evolved over time into this model food code. And the model food code, well, why do they have it? Well, the purpose of the code is to safeguard public health and provide to consumers food that's safe, unadulterated, and honestly presented. In other words, what we're trying to do here is protect consumers when they go to purchase food products that someone else makes. And what does this do? Well, the code is actually pretty comprehensive. It establishes definitions, sets standards for management and personnel, food operations, and equipment and facilities, and provides for food establishment plan review, issuing permits, inspection, employee restrictions, and then enforcement. So in other words, it sets out all kinds of definitions and the standards that food establishments need to follow to ensure that the food that they serve to their consumers is safe and that they're serving what they say they're serving. And one thing that's important to note about the Model Food Code is it's quite comprehensive, and it covers what food establishments, and this is a really long definition, and here's part of it, and you can see that it's really comprehensive. It's an operation that stores, prepares, packages, serves, vends directly to the consumer, and so forth, and it also includes transportation vehicles or mobile, stationary, temporary, or permanent facilities. The idea is that it's trying to cover any type of place that provides food to a consumer. Now, what's interesting about the Model Food Code is it itself is not a law. It's a model, and then each state decides to adopt the code or its own version of the code, and can do it by their legislature passing state law, or perhaps by regulations through their State Department of Health. And this actually is the most recent map that was up on the FDA website from 2007. And you can see, I can tell you that Kentucky has since adopted the food code, and North Carolina has a version of the food code. I cannot report, I didn't do the research on Northern Mariana Islands or Samoa, but you can see that pretty much now every state is following at least some version of the Model Food Code. The idea is that the health service does the science behind it, and so that we can, all 50 states, we can feel somewhat assured at least that there are standards being followed when we go to eat food at a restaurant or elsewhere. Now, how does this really work? Well, again, the state law passes the code, it sets the definitions and standards. In terms of implementation and enforcement, it's usually at a local or district level. So you may have a State Department of Health district office that you would go to get your permit, or it might be your local county health officer or your local county environmental health officer, and they would be the one that would do the inspections and the enforcement and so forth. But again, every state's going to be a little bit different. Regulation also happens at the local level, and a list happens through land use regulations. So we're going to talk very briefly about land use regulations and what that means. Some examples of comprehensive plans, covers, And you can see that various cities and counties develop comprehensive plans. And it could happen on your county level. If you're in a city, it could happen at your city level. And they are pretty comprehensive documents because what they do, it's the long-term policy guide for the physical and economic development of the jurisdiction. In other words, it's how your city or community or county intends to grow and change over time. And these are long-term planning documents. They cover a 10 to 30-year period, try to be quite comprehensive and typically address things like future land use, traffic and transportation, what kind of new road might need to develop or what kind of public transit needs developing, housing, what type of housing, where it should develop parks, recreation, open space, and public facilities, what kind of facilities will we need to support a growing community or a changing community. Then we also have zoning ordinances. And what are zoning ordinances? Well, those are the laws and the regulations that implement the policies we put in our comprehensive plan. Really, the easiest way to look at it is zoning determines what can and cannot be built on different parcels of land through the community and what kind of activities can and cannot take place. Most cities have a use-based code system. So the city is divided into districts, and we allow different uses in different districts. The best way to understand this is to really just look at a typical zoning map, and this is just from the city of Monroe, Ohio. And so when you look at this map, you see a checkerboard of different colors, and different colors have different meanings. The various shades of yellow mean residential, where people live, and the different shades depict whether it's single-family housing or two-family housing or multi-family housing, and that's the type of development that's allowed there. The pinks are the different shades of pinks are industrial development, heavy industrial, light industrial, and the browns are commercial districts, and you can see a dark brown in the center, which is the downtown commercial district. Green is agriculture. So what the city has decided is what kind of uses are going to be allowed in different parcels of land. And we do this because most residents don't want to live next door to a big factory or with traffic and possible other smoke bid or whatever. Now, we are starting, people are familiar with the term of smart growth, where people are looking at this use-based kind of district approach to zoning and changing a little. It may have some overlay districts, or people are looking into mixed-use developments where you can have commercial and residential more intermixed so people can walk or bike to get their groceries or pick up their supplies from the drugstore as opposed to having to drive everywhere. But this is generally what zoning does, is decides how and what can be done on different areas of land throughout the community. So we're talking about local regulation, and some question is, well, why? Why do we care about having local policies and local zoning that have to do with farmers markets and mobile food vending? And the benefit is you can set official city or county policy to increase access to produce and remove barriers to creating and preserving farmers markets and healthy vending through local regulation. You can allow your community to define what healthy vending is, what kind of vending will be allowed, and what kind of vending won't be allowed. And we can also allow communities to provide incentives to increase health food access. I'm going to turn the presentation over to my colleague, Stephanie Stevens, who's going to talk about some of the vending across America.
Okay, so vending across America. I'm just going to go ahead and give folks an idea of the various forms of mobile food vending in localities across the country. By saying that mobile vending actually has a very long history in the U.S. For example, New York City records show street vending regulations going all the way back to 1691. So just to give you some more examples, will see there are major differences as well as commonalities, and often the differences that exist in how vending is regulated reflect local culture, community, as well as conflicts that sometimes pop up between legal vendors, illegal vendors, and bricks and mortar businesses. Why don't we just go ahead and get started first with City of Angels, Los Angeles, California. It's a very interesting approach. If you've ever been to LA, you've probably seen that the city is home to numerous sidewalk and street vendors. What you may not know is that despite the thousands of vendors that you see, vending is actually largely illegal in the city of Los Angeles. Los Angeles has a law that allows for sidewalk vending in designated sidewalk vending areas. But in order to get an area designated as a sidewalk vending area, there are numerous bureaucratic steps one has to take, and it's quite complicated. So as a result, there currently is no designated sidewalk vending area in LA. There are some catering trucks that are allowed in some of the unincorporated areas, and even they have been targeted for more stringent regulation. Largely, that's been encouraged by bricks and mortar businesses that see them as unfair competition. So, for example, I think it was East LA, the key tried to enact a law that prohibited trucks from being for more than 1 hour, and if they stopped too long, they faced very steep fines. And vendors got organized. They had a lot of support from the community. As you can see from this slide, there was websites set up, saveourtacotrucks.org. Vendors actually sued the county successfully, but still the target of a lot of scrutiny. The other side of the coast and also the other side of the regulatory spectrum, we have New York City's green card. This is really a really great model for the possibilities of mobile vending to increase access to healthy foods. New York City amended their mobile vending regulations to set aside 1,000 green card permits. Green card is basically a vendor who's only selling unprocessed, whole, fresh fruits and vegetables. Program emphasizes underserved areas. It's also a great partnership model because the city is working with several organizations to provide micro business loans and technical assistance, as well as allowing community organizations and businesses to support the green cards. For example, requesting that a vendor set up in front of their business or referring their clients to the vendors located in the area. The city's website is also a great one-stop resource for information about the program. And the model, moving more to of the country, we have park district policies. For example, in Kansas City, the park district, through rules and guidelines, really tried to encourage healthier mobile vending in its parks. And how this works is that they set up a list of healthier foods like trail mix or, popcorn, dried fruit, and vendors who sell 50% of their items meeting these healthier criteria, they get a 50% discount on the cost of their park permit. If at least 75% of your meeting this healthier criteria, that vendor gets to run up to 3 parks, cost of just 1 permit. So it's just a way that localities can encourage healthy food vending. In their own backyard, we have the Oakland Fruteros, and this is an interesting story. The vendors in the city of Oakland were initially illegal up until 2001. Because of that, they faced fines and confiscation of their cards, organized, and they had some help from the county health department, and were able to advocate for a mobile vending ordinance, which allows X number of fruteros to operate in the fruit area of the city, which is a largely Latino area with few grocery stores. Churches have actually been fairly successful. They were able to purchase a commissary, which is a centralized kitchen where vendors can prepare food and also sanitize their equipment. And recently, we're able to even purchase a business center where they can offer training and other resources. But there's also, I must say, some growing conflict between the fruiteros who are operating legally and then some of the illegal vendors, and as well as the bricks and mortar restaurants who are doing this competition. So Amy alluded to earlier, mobile vendors are typically regulated under state and local laws, and regulations are implemented at the local level. And common regulations include things like the requirement to operate from a commissary, meaning the vendor must report to the commissary daily and clean their equipment. The temperature at which food must be cooked and stored. The requirement to have a permit, and actually you can see in this slide in the lower right-hand corner, you have the County of Alameda Health Department permit that has to be posted on the vending vehicle. Regulations will restrict where vendors can locate, how close they can be to a school, for example, as well as things like hours of operation. So we have a chart of mobile vending laws as they exist in the 10 most populous U.S. cities. And I actually produced this chart as part of an article that I'm writing with a colleague of mine, but we thought at the plan that it might be just illuminating for people in the community and advocates to just get a sense of the variation that exists in cities across the country, which we talked about earlier, from LA, which has this very convoluted and mostly illegal phenomenon going on, to New York, which is really just a model for healthy vending and what you can do if you really want to increase access to healthy foods in your communities. With that, I'm going to pass it back to Amy, and we're going to get into more detail about Implant's healthy food access tools.
I understand there's always some technical difficulties, and there's been some problem with volume, so I'm going to try to talk really loudly. So we have on this presentation, we're going to talk about our land use protections for farmers markets and our N-Plan model produce cart ordinance. As Christine mentioned earlier, we have lots of other model policies that might be of interest, including one on community gardens, healthy food zoning that food out around schools and other places. So again, please feel free to check our website for more information on other policies. First, we'll get started and talk about farmers markets, and of course, everybody loves farmers markets. What about state law? We talked about the food retail codes and how the farmers market is included as a food establishment, but in many states there are separate laws and regulations regarding farmers markets. So it's important to look at your state law before you try to implement our local policies. And also time for the cute dog pictures. So for those of you who might have attended the community webinar, you probably remember the dogs. And the dog on the left is my dog Charlie. He's quite, as most people would say, hyperactive, and he has an oversized bark for his size. And the dog on the right is his good Oliver, who's also very active and has, a good-sized bark of his own. But you can notice that they're also quite different. Oliver is considerably more petite than Charlie. Now, why do I show the cute dog pictures of that? And of course, I love cute dog pictures. Well, it really does illustrate a point, and that is we have people attending this webinar from all over the country, from different cities, states, rural areas, counties, and we recognize that not all dogs are the same and not all communities are the same. And so we need to, we realize this, and not every policy is going to work well for every community. So we design our local policies, we do the legal research, we know they're sound. We often will give different options for communities so that they can tailor it to fit their own unique characteristics. So you'll see that as we go through some of the policies. So on to the land use protections for farmers markets. So we talked about land use earlier, and see that our first policy is comprehensive plan language. And just to review, that's that comprehensive plans or general plans are those long-term policy guides for the physical and economic development of a jurisdiction. So what do we do with our comprehensive plan? Well, here it is, our comprehensive plan language. Well, we establish a goal, and the goal is to protect existing and establish additional farmers markets to increase access to healthy, local, affordable, and culturally appropriate foods, encourage building, support local agriculture and economic development, and promote agritourism. So we set our goal and to increase farmers markets and to protect farmers markets that already exist. And we also get in there, in one sentence, all these great benefits that farmers markets can add to a community. Now, not only do we set this as a goal, but we then give specific policies and actions that the community can take to achieve the goal. And these include encouraging the operation of at least a certain number of farmers markets in the jurisdiction, at least a certain frequency per week. And you can see in the brackets, we leave it blank for you to insert your own numbers, and that's that dog pictures come in. The idea that each community can tailor this so it meets their local conditions. We also have policies like identifying potential farmers market sites on public property, including parks. That's a policy that San Francisco County does. Also, schools, colleges, and universities. A number of schools have farmers markets on the weekend on their campuses. A great model is out of La Jolla, California, where their market has thrived so much they've been able to fund new library and technology programs at the school, and other institutions, and on private property, including hospitals and commercial centers. Kaiser Hospitals, which are located primarily on the west coast of Hawaii, has farmers markets on site at their hospitals so that employees and visitors and patients can obtain fresh produce, and where feasible, on streets using temporary street closures. So that's another model for a farmer's market. So other actions the community can take is to adopt zoning regulations that allow farmers markets as a permitted use, and we'll talk about that with the next part, and to give priority to establishing farmers markets in areas without a currently operating farmers market. And here's a map that was done in San Francisco of farmers markets located within a half mile, and you can see while some areas were well served, others were underserved. And these are the types of tools and the things that you can do with comprehensive plan policy so that you can make sure that farmers markets are established in those neighborhoods that don't have them. And while comprehensive plans are a long-term planning policy and they're updated periodically, they can be amended in between their big update. So your comprehensive plan can help to plan out your future for farmers markets and produce. We also have a farmers market zoning ordinance, and again, zoning are laws that communities use to determine what can be built and what activities can be placed in parcels of land throughout the community. So, to that, our model zoning language, we established. Point of that is to set forth that farmers markets can be used as an approved use in certain neighborhoods. Well, what does this mean? Well, again, we know that the farmers market will probably have to get some type of health permit or operating permit. But many communities, farmers markets are either not listed as a use in the zoning code or only allowed in certain areas or allowed at all without getting special permission from your local planning commission or planning department. What this allows is the community can select certain districts where a farmer's market may operate, and then allow, subject to the rules and regulations in the ordinance, allow those farmers markets in those districts without having to go to your planning department or planning commission to get a special permit, a conditional use permit, variance, or some other type of local land use. So it cuts down on the process needed to establish a new market. It can also preserve existing markets, because if you aren't listed in your zoning code, you're at risk of being shut down as an illegal use or being pushed out by a new development. So what kind of regulations that we suggest in the zoning ordinance? First, to define what a farmer's market is. There's a lot of different kinds of outdoor markets and flea markets, and some sell little dolls and some sell produce. The markets are an awful lot of fun to shop at, but they often have food, hot dogs and funnel cakes and all kinds of food that don't promote health the way fresh produce does. Not necessarily what you want to promote the healthy eating. So what we do, well, we define farmers markets in a two-part definition. First, we define farm products, and those are essentially fresh fruits, vegetables, herbs, nuts, and other food or products. And define farmers market as an outdoor market open to public, operated by a government agency, a nonprofit corporation, or one or more producers, at which at least, and we suggest 75%, but obviously that can be changed, or the products are sold are farm products or value-added farm products, and at least 75% of the vendors are producers or family members of producers. It's a two-part definition. You can change it. And the definitions are, the first definition is to ensure that most of the food sold are only farm products as opposed to hot dogs, funnel cakes, and tchotchkes. And the second part of the definition is that it's a direct sale market. That is, that the farmers are selling directly to the producers. And this is based on the California Certified Farmers Market model. The benefits are that the farmer is sold directly to the consumer, which takes out middleman and the shipping and so forth, which hopefully works to keep the cost lower. And the second piece is that the farmers can often sell produce that they may not be able to sell through other outlets. Perhaps it's too fresh, it won't survive shipping. And that way, the farmers can hopefully expand the amount of produce that they can sell, which gives them an economic benefit. Also define location. Again, this is where you decide in what districts in your community you think farmers markets should be able to operate. We also require operating standards. If you're not going to require the farmers market to go to the planning department to get a specific permit, you're going to want to make sure that it's operated safely and effectively. So there must be rules, market rules. You need a farmers market manager and so forth. Again, all of this can be changed by the local community. Finally, we suggest that you require that low-income residents have access to the markets by accepting the WIC farmers market coupons, the senior farmers market coupons, and the SNAP food stamp benefits. And we'll be talking more about that later. But benefit to doing this is you ensure participation by lower income residents. You also increase the customers for farmers. And in some communities, you can see there's Boston's Bounty Bucks. Local foundations and local cities are matching these to allow low-income consumers to double the amount of money they have to spend at farmers markets. And I love this poster for the City Heights Farmers Market in San Diego. That it's the first ET accessible market in San Diego. It's a low-income immigrant community, and it really demonstrates what we love about farmers markets, because it's not just a farmers market. There's a tamale contest, there's health screenings, there's bringing in all kinds of great benefits. That's our land use protections for farmers markets. We're now going to move on to NPLAN's Model Produce Cart Ordinance, and what this essentially is a way to set up a streamlined permit program for sidewalk produce vendors. And just a quick word about state law. Again, I know it's horrible, but just quickly, One of the really interesting things about the Model Food Code is that a food establishment does not include a produce stand that only offers whole, uncut, fresh fruits and vegetables. There's some other exceptions as well. As you can see, it kind of goes on and on. But the benefit of this is that for the states that adopt the food code as it is, or perhaps adopt this provision as it is, produce stands that are selling fresh fruits and vegetables are not subject to all the rules and regulations that are required for other types of food establishments. That means they're easier to set up and easier to get out quickly in the neighborhoods. Instead, you'll only need a local permit program, which is what our model ordinance does. But remember, your state may be different, and you need to be clear about what your state requires before attempting to implement this. I'll turn this over to my colleague Stephanie, who's going to walk us through the produce cart ordinance.
Okay, so I'm going to just run through this quick because I want people to have time to ask questions later. And also, let me just mention that all of the products as well as the chart that I showed earlier are available on our website, which is www.implan.org. Our produce cart ordinance and findings and also a fact sheet were just posted yesterday, so it's literally hot off the press. Our model produce cart ordinance is inspired by the New York Green Carts program and other mobile vending laws across the country, and the idea is to really make fresh fruits and vegetables as accessible as possible, especially in underserved areas. And this is what the model ordinance actually looks like. With all of our model documents, it's really designed to be tailored to the local needs and goals of the city or the county, and it also includes comments that explain the thinking behind the various provisions in the ordinance. So for definitions, the ordinance defines produce as processed, unfrozen, whole, raw fruits and vegetables that have not been combined with other ingredients. So we're really talking about like a grocery store produce aisle on wheels. What's fine about our model ordinance is that it's fairly simple. It's not very long, and there's not of defined terms. You really tried to keep it simple. That's a streamlined permit process for sidewalk vendors selling fresh produce. So what that means is a vendor who is applying to be a produce cart vendor, their application will be processed before other vendors. This is very similar to what New York City did when they gave green cart vendors priority placement on their very long waiting list for mobile vending permits. The model also defines location, and so that the vendors don't compete with stores. We also try to do things like avoid fire hazards, and also make sure that vendors are placed where there's likely to be a lot of foot traffic. We should note that in some communities, the existing mobile vending laws prohibit mobile vendors from locating close to schools, and that's the case for your particular city. Then what we suggest is exempting the produce cart vendors from that prohibition, because obviously we want our kids to eat healthy. Also defines operating procedures, and so this includes rules such as keeping area around the cart clean, keeping the sidewalks clear, red times that the vendors can be in operation, making sure that the cart is attended at all times. A lot of places will already have these kinds of rules in place, but we provided some that you can adopt for your own purposes. And most importantly, I think, about this model is that it suggests some incentives. We already talked about the expedited permit process, but other incentives that localities might institute are reduced fees for locating underserved neighborhoods, and there's actually a place in the model ordinance where certain neighborhoods can be called out so that the focus of the ordinance is to really be in those neighborhoods where there's low access to fresh fruits and vegetables, and hook up vendors with low-interest startup loans similar to the New York model, and technical assistance from other cities, nonprofits, and business groups. So what it requires is really work partnership and collaboration with other business, community members, and agencies to promote your policies, whether it's fresh produce, cart vending, or farmers markets. So to give us an example of innovative partnerships to move healthy food policies forward, we have Kami Papakuchi from Wayne State University in Michigan, and she's going to talk about setting up farmers markets and for accepting EBT. Let me just have Christine jump in and say a few words.
Thank you to Stephanie and Amy. That very rich presentation, lots of information in there. So I am going to unmute Kami. One moment, please. And this is a reminder to everyone, all of this information, the model documents are available on our website, and we'll be sending out a follow-up email tomorrow that will provide links to the website, so you'll be able to access everything. Kami, are you muted?
Can you hear me?
Yep, all right, great. So Kami is now going to talk about her work at Wayne State University to set up EBT at a farmer's market. And Kami is a professor of urban planning at Wayne State University, and she's also an advisor to the NPlan project. So take it away, Kami.
Christine, it's great to be here, and thanks everyone for joining the webinar. I'm calling in, so I can't see what you're seeing. So I'm going to have someone there advance the slide. So if I say next, please, just bear with me. It's really a request to advance the slides. I'll talk about our farmers market and the EBT, setting up the EBT at our market. But I'll start with an introduction of Seedwayne, the project that sponsors the market. Detroit is a food desert, and in the kind of definition that was mentioned earlier by Christine. And one study by Mari Gallagher out of Chicago found that about 50% of the food stamp or SNAP dollars, as they're called, are spent in convenience stores or smaller stores where there are not a lot of choices for fresh fruits and vegetables. So with that, let me go to the next slide. A quick background on Seedwayne. Seedwayne stands for Sustainable Food Systems, Education and Engagement in Detroit and Wayne State University. And the goal is to collaboratively build sustainable food systems on Wayne State's campus as well as in Detroit neighborhoods. And collaboratively is the operative word. We work in partnerships for every activity that we engage in. And by sustainable, I mean really I use the 4 E's to define sustainable. These systems have to be economically viable, ecologically regenerative, socially equitable, and engaging of community members. I won't elaborate on those, but they are very important for us. And the idea is also to link systematically and as comprehensively as possible to university's core mission in education, research, engagement, and operations. Next, please. We have projects on campus as well as in the community, and on campus we have vegetable gardens in which students are involved in producing either for donation to area food assistance programs or for their own consumption or for trade or exchange with their friends and families. We work with our local food service operations to do local sourcing from local farms, as composting food wastes at one cafeteria right now. We have a lot of educational activities in the form of public lectures, university-wide lectures, classroom seminars, projects in various departments across campus, and then student-led workshops. And we also have several research projects across in interdisciplinary teams across campus, and of course, our seasonal farmers market is a flagship project that I'll talk more about. Next, please. In community, we have really two main activities. One is we're building a 4,000 square foot passive solar greenhouse on the site of the Capuchin Soup Kitchen. That's a very important community partner for us and a base of our community activities. To supply food to the soup kitchen year-round, and the idea being to demonstrate that local, organically produced, sustainable food systems are not something that are just for the wealthy and for people who can afford to pay, but for everyone. And we have a program called Detroit Fresh that's now taken off. It says pilot project on your slide, but it actually is a full-fledged project now, and we've received some fresh funding for that. And we're working with corner stores in starting with the east side neighborhoods and getting them to carry more fresh fruits and vegetables. And so we connect them to a distributor that delivers smaller quantities of fresh fruits and vegetables, as we conduct social marketing in the neighborhood by flyering around the store and working with community groups around the store to spread the word. And the picture at the bottom is one of our stores. It's African American owned, and the owner, Tyrone Barden, is standing there proudly next to his produce. Next, please. Last year was our full first season of our farmers market, and it went from the first week of June to the last week of October. And so we had 23 Wednesdays on main campus in Detroit, and 2 pilot days on our medical campus, which is a month and a half away from where the main campus market is. And after trying several time slots in 2008 in our pilot season, we stuck with 11 a.m. To 4 p.m. with our lunch slot really being the most popular slot. And last year in 2009, we averaged about 10 vendors per day. We had the gamut of fruit and vegetable producers, flowers, herbs, honey, baked goods, some dessert products, and I'm sure I'm blanking on some other. We had grains as well. No dairy, unfortunately. We're still working on our local dairy, a local dairy vendor. About 1,000 customers a day, and we estimate, and this is really a very conservative estimate because vendors don't all share their sales figures. We estimate $175,000 total sales for our market season, our first full market season, which I'm very proud of, even though it's, I know that there are a lot of other markets that are a lot bigger than that. And we did $5,000 in SNAP, which is the food stamp, or it's also called EBT, Electronic Benefit Transfer sales. And it was very important for us to have SNAP in our market because even though the main target audience is our campus community, faculty, staff, and students, and of course there are members within our campus community that do receive SNAP benefits. We want to make sure that our farmers market was accessible to a broad audience, customer base in the city of Detroit, and also to make sure that that money was available for our farmers as revenues. So I'll talk a little bit about our permitting process, and it was a little more complex for us because we did it as a partnership, but it doesn't have to be that way if you're a nonprofit or a government agency that's trying to get SNAP into your farmers market. Next, please. So in addition to the Bridge Card, which is what our SNAP program is called in Michigan, we have other programs at the market, and Christine, I believe, or maybe it was Amy, talked about some of these in her presentation. So we offered the Bridge Card, which is the food stamp program, We also offered Project Fresh, which is the Farmers Market Nutrition Program. It's called Project Fresh in Michigan. And in Michigan, that consists of $20 in a season that's given to participating households. So it's not very much. And for our area, those coupons got delivered pretty late in the season, so we started seeing them in September and October. And we also, through a partnership with the Fair Food Network, we had a program called MOBUX, which is the Double SNAP program. They received funding from Wholesome Way Foundation and some other sources locally as well as nationally. And it was a pilot tested in all of Detroit's farmers markets last year. We offered it on 5 days last year, and we think we like to explore the possibility of offering it season-wide this coming year. We also took the State University One card, which is an identity card that also acts as a debit card where students and faculty deposit money in their card, and then they can then use that to spend money at the farmers market. So as I mentioned before, we did just a few dollars, less than $5,000 in SNAP sales last year, and a couple $100 over $5,000 in our card sales, which is very good for us, given that was our first season. And in 5 pilot days for MOBUX, our Double SNAP program, during which we allocated $200 for each day, we ran out of money before clock on most days. So we certainly could soak up more money that program when we offer it next time. And what's great about the Double SNAP program is it really provides many wins. It's a win for SNAP participants, obviously, because they get benefit for their SNAP dollars. So if they swipe $10 on their card at the market, they essentially get 20 tokens. It's great for our farmers because we're leveraging food stamp dollars and putting more money in their hands. And it's great for our market because it attracts people to our market because of the additional benefits that they get. We also offered 2 cooking demonstrations where Chef Allison Costello of the Capuchin Soup Kitchen demonstrated how to cook healthy, locally sourced products, and we got products from the market for her demonstrations. Those were very well received. We also offered other incentive programs like free massages that was sponsored by our campus-based recreation center, and some coupons that were distributed for participating in physical activity programs that were also offered by the recreation center on campus. Next. So here's an image of one of our stalls. It's the Grown in Detroit cooperative where gardeners essentially in Detroit pool their product and offer it for sale at the market. And left-hand side, you can see the 3 flyers. The top one is for the EBT. Every stall had a flyer that said EBT tokens accepted here with an image of the token. The yellow flyer was for Project Fresh, and that was only farmers that sold fresh fruits and vegetables were eligible. So honey and grain farmers were not eligible for that. And then the third one is the pink voucher that we distributed. That's the MOBUX, or the Double SNAP program. Next, please. This is from the farm market. We had some really wonderful feedback from our customers. We had students from 4 schools come by in groups where teachers brought them to talk about lessons related to food systems and so on. So it was really a great experience. Our first full season was also a lot of lessons learned that we're going to do some things differently this year. Next, please. Our pictures from our medical campus, the two pilot days that we did last year. That was also very well received. Please. So our image of our tokens. On the top left, you'll see the BRIC card, which is the EBT card in Michigan, where the food stamp dollars are deposited. And the green token is the token that's changed in return for swiping the card. So what happens is a customer with a bridge card comes to the market, go to the EBT station, swipes their card for the amount they wish to spend at the market, and then we give them that many tokens, and they can then use the tokens at any vendor in the market. So any vendor that qualifies anything that's any sells food, which is every vendor, can take those tokens. The one card token is the purple token on the right-hand side, and that's the university identity card. At the bottom is the Project Fresh logo, which is the Farmers Market Nutrition Program. And then Michigan MoBucks, it was a pink voucher, whereas other markets had other colors. Please. Our authorization was a bit complex because we are a university program, and so we have to go through our university finances for all financial operations. And so when we approached our administration and asked them to help us become authorized, when they looked at the kinds of payments that would need to be made to vendors and the levels of payments and the frequency of payments, they decided they did not want to do it because they essentially came back saying that the cost of processing those checks would be a lot more than the face value of the checks. And so that really delayed us by a couple of months because we had this collected all the forms and gotten all the advice and so on. So we approached Eastern Market Corporation, which is the largest wholesale market, produce market in the area, and also the largest farmers market in the city, and they agreed to partner with us. And so we submitted our application together. We got approved together. It was a complex process because the office did not have any experience with it. So we had the Chicago office, which is a regional office, intervene and essentially tell the Detroit office to approve us. And we think we are unique in being authorized like this. And so it's a model, especially for universities and other institutions that are reluctant, as our institution was, to go through the whole financial operations process. So what works is that Eastern Market is our fiduciary. So they set up the account so that when the card is swiped at our market, its account gets money deposited from the SNAP program, and then we collect all the tokens from vendors and keep records of which vendor did what kind of business, and then we send a copy of those records to Eastern Market, and Eastern Market cuts the check to the vendors. And so it's worked out pretty smoothly, and Eastern Market is a great partner. They've charged us only a very nominal fee for acting as their fiduciary. So lots of communication, and we now have an established procedure for working it out. And so that's what we mean by the split management. So I'm responsible. As the market manager, I'm responsible for ET operations at the market, and Dan Carmody, who's the president of Eastern Market, is responsible for the management of the fiscal operations. Many clients, our EBT clients, are members of the university community, but we're finding out that, especially towards the end of the market, as word of mouth spread, both about EBT availability as well as the double SNAP program, and the fact that we were able to make free parking available near the market, more and more EBT customers were community members. And so this year, we'll try to do some surveys to get more information about exactly who they are, how they heard about it, and why they're here, what they're shopping, and so on. But we know that one vendor who sells almost exclusively fruits was our biggest revenue generator in terms of EBT tokens that came to him. So fruits are clearly very attractive for people who are shopping with their EBT at our market. Stop there and see if you have any questions. Please go to Google see Dwayne to learn more about our programs, the farmers market, or if you want to contact me.
Great, Kami. I'm going to leave you unmuted while we do questions. We can get your perspective on some of these. So just as a reminder to folks, before we get started with the questions, I will be sending out an email to all of you tomorrow with links to the model policies that we discussed and to our resource page, which is not up yet, but when it is up, it will have links to the presentations that you download and a recording of this webinar, as well as the resource document that Amy mentioned. So keep for that. And in exchange, we ask for you to please complete a survey about this webinar, and there will be a link in that email with the link to the survey. So please do complete that because it helps us plan future webinars. So we have lots of great questions. Please continue to use the Q&A box. We will try to get to as many as possible in the next 20 minutes. The first question is I'm going to give to Amy, and it is, if a community's comprehensive plan is 40 years old, can healthy food access policies still be implemented? We need to first adopt a new comprehensive plan.
Thank you. This is a great question. And unfortunately, a lot of it depends on the law in your state. In some states, it's required that you update your comprehensive plan or general plan periodically, and then the state law may say every 10 years or every 15 years or so forth. And I don't know what state you're from, I don't know what the law in the state is, but it's a little surprising to me that the comprehensive plan hasn't been updated in 40 years. But in many states, you may amend your comprehensive plan in between reviewing and renewing the whole comprehensive plan. So depending on what your state requires, you may be able to just submit this model language as an amendment to the plan. In most states and localities have certain processes you have to go through in order to amend your plan, including public hearings and public comment and so forth. So you're going to have to look at your state law and your local city processes, but you can contact your local planning department or planning commission that in your area, and they can let you know what the process is.
Great. This couple of questions are for Connie about funding. In particular, how did you fund the double SNAP benefits, and was it costly or difficult to acquire says the EBT cards, but maybe it means the machines to swipe the cards. So could you speak to that a little bit, Kami?
Sure. We're funding from the Fair Food Network, which got essentially pulled together funding from a variety of sources. And I know one of the sources was the Wholesome Wave Foundation, which does fund these kinds of double SNAP programs in other places as well. And they got some money from a couple of local sources as well as national sources, but I'm not 100% certain about exactly what those are, so I'm not going to mention them. But if you want to get more information about that, you'd be able to go to the Fair Food Network site and either actually find the information there that you're seeking about funding, or find contacts there who might be able to help you. And Oren Hesserman might be a good source to go to, and there are other people identified there as well. The second question was about the EBT machine. When you get authorized, at least this is in the state of Michigan, I'm sure it's true nationally because our machine came from someplace in Texas. Once you get authorized, you have to submit paperwork to get authorized to accept food stamps, and they approve your authorization. They send you your first machine free. And then you need additional machines. I think you can buy them. I don't know the cost for that because we just used one, and we made an additional one for the season, but I haven't quite looked that up. But I think, if you start the process of getting authorized, you'll get more information about getting the machine.
Hi, Amy. I wanted to just follow up the comprehensive plan question, just to note that an alternative to amending your comprehensive plan is to just go forward with the zoning ordinance, and that way you can make changes in your community without going through the comprehensive plan. And then second, I just wanted to add on to what Connie said, is there are a number of communities around the country that have these types of double SNAP programs. Boston, San Diego, City Heights Market, and farmers markets in Rhode Island have Fresh Bucks. And from what research, most use a combination of either city funds or private foundation funds.
All right, thank you guys. Another question, I'm going to give this to Stephanie first, but Amy or Kami, feel free to weigh in also. Who are the critical partners in passing a healthy vending or farmers market policy?
So, with regards to healthy vending policies being passed, to a certain extent, that's going to depend on the politics and realities that exist in your community. But using the Oakland Fruteros as an example, first you had the vendors themselves who were able to get organized, and that was really because there was one woman in particular who was really on top of the situation and was able to organize the vendors themselves. The health department was a partner in that effort as well. And they also were able to get a local councilman to really be in their cause, and he was the council person for that particular area, which is the fruit area. So if you can get the vendors organized, if you can get a local health department on your side, and if you can get a local government representative to really champion your cause, I think those would be great places to start. And farmers markets, do Kami or Amy want to?
I think the same applies to farmers markets as well. I would definitely start with elected officials who can set the agenda for the planning department and for other agencies to get working on it. Who champions issues related to sustainability, healthy food access, nutrition, obesity, those kinds of issues, and start there. I would also go to your planning department and see if and share your concerns, and especially any information you have about the experiences of other places that have had successes or model policies with the planners. Any information you can give about any assessments that were done in your own community about the state of healthy food availability, or or any visioning that was done by a community process, to share the findings from those processes. All those would be good things to do.
Great, thank you. We've gotten a few questions about the perception of who consumers at farmers markets typically are. And so I'm going to give this one to Kami, but then others weigh in. This question says, you have to fight the perception that markets are for wealthy white consumers. Does the makeup of your market vendors reflect the makeup of the neighborhood that you're serving? Do you think that that's an important element of success for market?
That's a great question. It was very important when we started the farmers market to communicate to vendors that we have a wide diversity of clients and customer base. Residents who would be shopping with their EBT cards, even though we weren't authorized, when we first contacting vendors yet, but we expected to be, and the fact that the typical farmers market enthusiast tends to be middle class, tends to want to get fresh, healthy food and all that kind of thing. And then we're in a university, so we expected that staff especially would be our major customer. So we alerted vendors that we wanted, that we were going to pay attention to pricing and that we wanted pricing to be accessible. It was very important to advertise the EBT, the fact that our market accepted EBT and welcomed community residents in all of our public materials. And then, of course, making parking available for free meant that campus became accessible in a very immediate way to people who were passing by or who heard about it. And we also wanted to make sure that our market was located on the sidewalk next to a main street rather than the heart of campus, which is a kind of a diag where there's no traffic, no automobile traffic around. It was the preferred location by one of our administrators who's a key partner in the market. We wanted the market to be visually seen by people traveling on the bus and close to a bus stop, and so on. So in our materials, we communicate the fact that this market is very accessible. And, when I talk about it, I talk about the prices of key products that are popular, just to give people a sense that it's something that is affordable to everyone.
And I think Amy wants to jump in, too.
I think, all of those suggestions from Connie are great. And I think one thing that is that the communities around the country are really taking a variety of approaches in order to make the boost accessible to our income folks, but also to bring it into communities that don't have it. And one of the things I'd like to highlight is the city of Minneapolis just instituted a streamlined permitting process for small farmers markets to increase fresh produce in low-income neighborhoods. These markets are small farmers markets with far fewer vendors to sell locally grown produce, and they can bring them right into the community. So they may host them at they're hosted by community organizations, and so they could be at a community center, a local library. It could be hosted by a local church, and these are ways to just bring it in to the community. So there aren't a lot of the barriers that it might just to go to other markets. And I think that's the idea of our local land use policies, is to get produce into communities so that people don't face transportation barriers and other barriers.
Just a technical note, if you saw a bunch of slides flashing by your screen, that was my fault. I'm trying to scroll through the questions, but instead I'm scrolling through the slides, so I apologize for that. And we're going to a few more questions, but I first just want to let folks know if people need to leave early that we have another webinar scheduled for April 20th, and it will be on joint use agreements and how to use those to open up new recreational space in communities that might not have enough. So we'll be sending out an email to everybody who participated in this webinar when those registration details are available. So back to the questions. This one is a data question. Are there data available that show the percentage of income from farmers markets that comes from WIC vouchers and other public benefit vouchers? Alternatively, are any data available related to the use of vouchers at farmers markets?
Well, the public benefit programs are run through the U.S. Department of Agriculture, and the USDA Food and Nutrition Service actually has an archive of redemption data at farmers markets. And I give the website to look at, and Christine will post it, www.ams.usda.gov. And if you follow that through, you should find some information about redemption at farmers markets. I just want to note that they did a market survey, but they believe it's outdated now because portable EBT technology became much more affordable mid to late 2000s, and that's caused a dramatic increase in the number of farmers markets and availability of federal funds. And the USDA has a farmers market promotion program, and this will be on our resource list. And these are grants that are targeted to help improve and expand farm markets, roadside stands, community-supported agricultural programs, agritourism activities, and other direct producer-to-consumer market opportunities. And the amount of funding has really dramatically increased under the 2008 Farm Bill, and they expect to increase to $10 million for fiscal year 2011 and 2012. So there's an opportunity there to help get some support for making your farmers market able to accept EBT and able to expand. In addition, people probably heard just, I guess, last week about the Healthy Foods Financing Initiative that President Obama announced. And we don't have a lot of details yet, but I believe about $20 million will be dedicated to support farmers markets and other sources of fresh, nutritious food. So we'll also have some information about that on our website, although right now there's not a whole lot of details, but it does bode well for the future for increasing access. But I encourage people to look at the USDA website for more information about public benefit programs at farmers markets. We also have some information on our actual policy tool.
Great. I just got a note from someone who's listening who is from the USDA, and they said that there is a specific side for EBT use at farmers markets via the Farmers Market Promotion Program grants. And this person says that the notice for the 2010 grant application will go out sometime this week.
Great.
Check it out. Also on the EBT front, Kami, one person was wondering if there were any resources that you found that helped you understand the EBT regulations.
Just speaking broadly, our Michigan Farmers Market Association was very helpful in getting, helping us think through how we do, the contacts needed for getting our application processed. So, that was a great resource, for example, in just getting our permitting done because of this very, because of the fact that we were a university program and we were already so different from the retail model that the EBT set up for. So in general, I think if you have a farmers market association or a group like that, you should definitely speak to them about assistance related to EBT. I put out or downloaded everything that I could get on EBT, and between our student leaders and I, we read through every single one and tried to understand the system that way. There's also a workshop that was offered by MIFMA, the Michigan Farmers Market Association, that encapsulates some of these things.
Thanks. And I think this is going to be a final question, but there's been some questions about farmers markets in a rural context, and one person wondered what could be done to give maybe large home growers of fresh produce access to a farmer's market so that they could be, one of the people selling at the market. So, Amy, do you want to speak to that?
There are markets that are doing this. The San Diego market I mentioned earlier actually has a backyard grower stand at the farmers market where those with backyard gardens can sell their produce. And it's particularly nice in that community because it's a large immigrant community, and there are certain products that are unique to immigrant communities or are harder to find, and that gives an outlet. So that is possible. You need to look at your state farmers market requirements to see if any type of certification process you need to go through. Some people also want to know about people creating home valued products from their produce and selling them. And again, one involved with something that requires cooking or so forth, your state food retail code is probably going to govern what you're allowed to do, what you're allowed to sell. Some of them accept out products that are made at your own kitchen. Some may have specific regulations as to farmers markets. In other places, that might be a barrier, and certain communities have come up with some solutions around that. Stephanie mentioned the Futeros were able to get a communal kitchen. There's a program in San Francisco called La Cucina, which has a standard kitchen that low-income entrepreneurs can come in to make their products there. And some faith communities have used church kitchens, which meet a state requirements so that people can come in and produce products. So unfortunately, a lot of this is driven by our own state law, and you have to look locally. And generally speaking, the state law is fairly accessible, and I really encourage people to use the university cooperative extension programs. Many of your local state universities have very good websites that describe farmers markets regulations.
And I think we're at about time. So thank you so much to Kami and Amy and Stephanie for their presentations, and to all of you for joining us. And keep out for an email from me tomorrow with links to all the resources that were mentioned during today's webinar, and do fill out our evaluation survey. And if you would like to ask for technical assistance about any of these policy or legal issues, don't hesitate to contact us. You'll have my email address in the email that I send tomorrow, and you can also go to the Ask a Question part of our website and submit a question using a form right there. So thank you and have a good day.
Thanks.